So once we have done evaluation of the patient and the follow-up, and we've come up with a plan, either the plan is surgical to fix a problem, or low-tech fertility treatments, or high-tech fertility treatments. This segment is to talk about the low-tech fertility treatments. And the low-tech fertility treatments are basically involve doing artificial inseminations, intrauterine insemination basically, with or without drugs. So you can have intrauterine inseminations without drugs because of a sperm problem or a cervical factor. And all we do is at the time of ovulation, or the time we determine, we put sperm past the cervical mucus into the uterus. This is for specific patients who have low sperm count issues but not severe, or people who've had surgeries on their cervix and the cervix is not is a hostile basically environment for the sperm to enter. In other cases, we would use drugs, and that's still part of low-tech fertility treatments. And the drugs we would use is either in the form of a pill, like for example clomiphene citrate or Clomid, or in the form of a shot, and that would be an example would be in injectable drugs that have FSH in them, or LH mixed. And these fertility drugs will be used in conjunction with the intrauterine insemination under the category of artificial insemination, or AI, which is low-tech treatments. So why would we pick one versus the other? Well, we would say that, in your case, maybe by adding fertility drugs to make you ovulate plus put sperm in, it increases your odds. Or by increasing the number of eggs by taking these fertility drugs or shots, we increase the odds of an egg being produced that can meet a sperm at the right time. Now, we sit down and talk about low-tech treatments and say, your baseline pregnancy rate is at age 20 about 20%, but at age 30 it may be around 10%, and at age 39 around 3%, and by age 40 to 45 around 1%. And by doing the fertility drugs, the pills, and insemination, you double your chances. So a 20-year-old has a 40% success rate with Clomid and intrauterine insemination, and a 30-year-old has about a 20% success rate per month. And a 39-year-old may have about a 6% success rate, and a 40 to 45-year-old may have a 2% success rate. Now, with the shots, the baseline numbers triple usually. So a 20-year-old who had a 20% chance of success now has a 60% chance of success. A 30-year-old who had a 10% chance now has a 30% chance of success. And a 39-year-old who has a 3% chance of success now has a 9%. And a 40 to 45-year-old who had a 1% now has a 3% chance. And so we look at the success rates, we look at the cost of treatments. Obviously the pill and the insemination is cheaper, shots and insemination more expensive. And we say, well, based on your situation, based on the egg quality and sperm and the two fallopian tubes, I think it's best to do this treatment, or that treatment, but you have to understand that these success rates are A, B, or C. So the patient is fully understanding of what they're doing, what's their cost, and what's that success rate. And notice, nowhere did I ever mention 100%. You either get pregnant or you don't in any treatment. But the treatments that we just talked about, the artificial inseminations with pills and insemination, that doubles the baseline chances. The shots and insemination triple the baseline chances. And the more aggressive treatments, obviously, which we'll talk about later, increase the odds much more. But it is quite possible that a low-tech treatment that has a lower chance of success may lead to a 100% chance of baby, and a in vitro fertilization, which has a higher success rate, may lead to no pregnancy. So people have to understand that we don't need to always rush to the most aggressive and expensive route. As long as it's reasonable, we can stay in the low-tech area of just giving fertility drugs and doing insemination or shots and insemination. Now, this cannot continue forever. You can't do this for 3 years. You would have to do these low-tech treatments for 3 to 6 months, depending on the age of the female partner. So if you're below the age of 35, you could do up to 6 months of these low-tech treatments and be okay. But if you're above the age of 35, it is unreasonable for you to do more than 3 or 4 months, but the maximum is no more than 6. So 3 to 4 months of low-tech treatment, if it's not working, we need to move, because since the odds of success are lower, and we don't have a lot of time sometimes, we don't want to waste time in the low-tech treatments. But we should not ever just skip the low-tech treatments just because they have a lower chance, because many people get pregnant with these treatments.